who've been given the first Pfizer jab, many of them now being told you don't have to have it after 3 weeks, as we told you you had to do. You have to wait 12 weeks, and they're feeling anxious and they're feeling insecure about the efficacy of that first jab. What reassurance can you give them?
Well, the first reassurance I can give them, Piers, is that this is an incredibly important question that we looked into in great detail, and it's only because you get that protection 2 to 3 weeks after your first jab that we can make this decision.
And what protection do you get? I mean, do you know?
We do. We know from the trials that from around 12 days after the first jab, you start to get that protection.
How much?
And the protection from disease, from catching the disease, is 89% after the first 2 weeks. So you've got to wait those 2 weeks. And that compares to 95% once you have the 2 jabs. But crucially, the protection against having serious disease, being hospitalized or dying, is even higher than that. And in the case of the Oxford jab, is 100%.
Okay.
So it's only because you get the protection after 1 jab that we're able to make this change, and the whole thing is based around how we can save most lives.
Yes,
and
as we've said, we want as many people as possible to get at least the first dose. But how protected are you? Because I think there is a concern that if you delay for 12 weeks, the protection is in some way compromised. That is what people want reassurance on. You'll get 89% protection after 2 to 3 weeks. But what happens if you don't then get the second dose until 3 months later?
That level of protection is maintained. And the chief medical officer has looked into this, and Jonathan Van Tam, the deputy chief medical officer, who's the expert in this area, has written a really clear explanation of why that is. So the level of protection is maintained. The reason we've moved the second jab to 12 weeks is so that, firstly, so we can protect as many people as possible, and secondly, because we are confident that up to that point, the protection is maintained.
Why aren't they doing that in the United States? If everybody was confident about that, why are we not being followed by the States?
Well, one of the advantages we have in the UK is because we have the National Health Service, we can make these decisions based on what is in the best interest of everyone. And the way I look at it is this, the way I think about it is this. If you have 2 grandparents, both in their 80s, and you have 2 doses of vaccine, would you dose one of them twice or both of them once? And given the level of protection you get from 1 dose, I would dose both of them once each every time. I mean, it's an absolute slam dunk in terms of saving lives.
OK, I hope that's reassured people. Let me ask you this. We think we've vaccinated 2.6 million people now, is that right?
2.3 million people, 2.6 million doses, because some people have had both.
It's a very good start, because that puts us in the top 3 in the world per 100,000, and I congratulate you on getting us this far. But clearly, we also have one of the worst case rates right now with this variant, and the battle is on. The race is on between tackling that and the vaccines getting rolled out. How many vaccines do you have at your disposal right now to go out?
Well, we have enough to be able to hit the target of vaccinating the 4 most at-risk groups by the 15th of February.
How many do you have today ready to go?
Arriving in time to do that. So it's a just-in-time delivery system. As the vaccine becomes available and gets approved, because each batch has to be tested, then we ship it out to the GPs and the big distribution centres.
No, I understand how the system works. It's just we're getting lots of people saying, look, we're ready to do more, but we haven't got them. So is there a supply issue? Do you want to go faster, but you're hamstrung by supply?
Of course, if I had more supply, we would go faster, because as you say, there's GPs who say that they can do more than they're doing at the moment. So the constraint is supply. But that's not because supply is coming slower than the schedule. It's coming on schedule, and then we get it out the door. So we're doing more this week than last week. we did twice as many. We did as many last week as we did in the whole of December. We'll then keep increasing the numbers and keep accelerating.
Why are you not doing it 24/7 in certain places? Because there are lots of people who do shift work. We're a 24/7 country now. Why can't you just have that facility for health workers, for teachers, whoever it may be, important people who may be doing shifts, get them down to 24/7 centres through the night?
Yeah, well, we're up for that. And if that will speed up the delivery, but because the rate limiting step is supply, most people would prefer to be vaccinated in the middle of the day, and most vaccinators would rather work in the day. But I don't rule that out, especially, as you say, for shift workers, for instance. You know, if that is the easiest way to get it to them, then yes. But you know, as I say, the good news is we're managing to get it out into arms as quickly as the two companies are delivering it to us, and that's the mission.
Yeah. At the moment, Mr. Hancock, are you still on track to jab everybody in the top 4 vulnerable and elderly and care home groups by the middle of February?
Yes, we're right on track to do that.
And then one of the things that people are arguing is that there are other groups who need to be bumped up the list. You know, for instance, teachers. In order to stop our children having more devastation inflicted on them by the lack of proper education while the lockdown closes schools, should teachers be the next in line to get the jab?
Well, I think they've got a very good case for that after the clinically vulnerable. And so, you know, we've got to vaccinate the clinically vulnerable first, because that's what prevents people from dying. And we've got to prevent the pressure on the NHS as well. And of course, the vaccine will help to do that over the next few weeks. But right now, the way that people can do that is by following the rules, both the spirit and the letter. Once we've got through the clinically vulnerable groups, then we've got a debate to have as a nation about where we go next. And I think that teachers and police officers, actually, and shop workers have got a good case that they should be next, as opposed to just carrying on through the age range once we've done all of the
It's within your gift as a government minister to decide. It's you know, obviously all those groups will campaign, but is it something that you will do?
It's certainly something we're looking at, but we haven't made a final decision on it yet. And so I think the debate is healthy. What we're doing is we're monitoring the rollout now, because how we go through the next groups will in part be determined by how much the vaccine reduces how much you transmit the virus, as well as how much it protects you.
And when do you hope to know that crucial piece of information?
In the next couple of weeks. So before the 15th of February.
Because that's hugely significant to people who would then be able potentially to venture out of a house they haven't left in 9 months in some cases, wouldn't it?
That's right. It's a very, very important piece of information. On Monday, we published quite a technical document about how we're monitoring that, and it's one of the facts that I'm really looking forward to finding out.
Priti Patel yesterday held the Downing Street conference, and what she couldn't answer, and I want you to answer this if you can. We're in the second proper national lockdown. The November one was a mini one, not the full national lockdown, and yet we're told by you and other government ministers, this is a more serious stage of the pandemic than even the one we faced back in March, April. Why is the second national lockdown not as tough, and it indisputably is not as tough, as the first one? Can you explain that, given the situation is apparently worse?
Well, we've learned a lot about the virus. One of the things that we've learned is that it is less likely to spread outside. So one of the differences, for instance, between this lockdown and the March lockdown is that instead of saying you can go out and exercise, but you can't meet anybody else, we're saying you can see one other person for exercise, because we know that especially for some people, that is really important for sticking at it and sticking by the rules. And it's a lifeline for some people. Now, I don't want anybody abusing that rule, and I don't want to have to take it away, because I know how important it is. But if you exercise, not socialise, exercise 2 meters apart from somebody outside, then we now know that the risks of transmission are extremely low.
But why are you letting, for example, if it's as serious as you say it is, why are we letting, estate agents stay open? but you can't have, pubs and bars and restaurants open, but you are allowing lots of strangers to go into houses with people all day long from estate agencies. Why?
Well, that has to be done in a COVID-secure way and with people keeping their distance.
Well, what's the difference between that and a restaurant that's COVID-secure?
Well, the purpose of going to a restaurant is to socialise. And
the purpose of going to a house is to buy it. I mean, why are you encouraging people to even be thinking about buying property at this critical stage? That's my point.
I know, and I'm trying to explain the difference in the restaurant is you go there for the purposes of socialising. If you want to buy a house, you can go in 2 meters apart from people in a COVID-secure way, and also the numbers are much lower. But we've got to try to get through this the best that we can. So we've learned a lot about the virus. We've learned a lot about putting in place COVID-secure rules. And we haven't picked up a great amount of transmission.
When will you know the data from the start of this national lockdown that may necessitate tougher restrictions being brought in? Do you have a day?
Yeah, that's a really good question. So the answer is that we look at it all the time. And if the way I think about it is this, that it typically takes about a week for an increase in infections in real life to turn up in the data, and then another week for those to start to turn up in hospital admissions, a week to 2 weeks, really. So I'm looking now a week and a bit on from bringing in the national lockdown. It was Wednesday morning last week that it was brought in. I'm looking to see the case rate just starting to level off. I hope that's what we start to see over the next few days. So the few days ahead of us is the critical period to know whether this national lockdown is working. But of course, it isn't. It isn't just about the rules. It's on all of us together to do this, because it's all about following the rules in letter and in spirit.
OK, I want to ask you this question. You have 3 children. Do you know how much you spend on food a week for your family as a household?
I don't know precisely, because unfortunately I don't have much time to cook at the moment. I'm mostly in the office. But, so I haven't got an exact figure.
Would you hazard a guess about roughly what you spend a week as a family?
I'd have to go and look it up. I'd have to go and work it out, Piers. I'm not going to have a stab at it.
OK, the reason I'm asking, and I'm sure you know why I'm asking, is this food parcel scandal, no other way to describe it, which has erupted, where you have contracted out responsibility to private companies for sending food to the poorest families in the country, driven into this by Marcus Rashford, to his great credit. And this, which I'm showing here, is what they deemed was enough for a family for 1 week of food. This is a loaf of bread, 2 satsumas, 2 slices of ham, a dark apple, 1 tin of baked beans, 2 baking potatoes, 5 slices of cheese, and inexplicably 5 bottles of water. This is a complete disgrace, Health Secretary, isn't it? Yeah.
Well, absolutely. The company have apologised for what they've sent out, and I'm really glad this surfaced on social media. And some people complain about social media, but I think this is one of the upsides.
Why are they sending out any water at all in these parcels?
Like you, I've got absolutely no idea.
Have you banned them? Have you now said to them no more water to be sent out?
Well, I'm glad they've apologised. They've clearly got to up their game.
Yeah, but you're the Health Secretary, and this is the health of the poorest kids in the country. You are allowed to say to them, I don't want to see another bottle of water in any of these parcels again.
Use your money more wisely.
I want to see good, high-quality food. I'm really glad that we're able to send out food for those who receive free school meals when schools are in, and I'm really glad that we're able to do that when schools are out.
If you're that glad, can I just ask you a difficult question? Why did you vote against it?
Well, I'm really glad we were able to put it into place.
Yeah, but if you're that glad about being able to put it into place, again, why did you, as Health Secretary, vote against this?
Well, because the reason that I'm glad now is because we've been able to sort that out and put it in place.
Well, the reason you're glad now is that you got shamed.
No thanks to you.
Let's be honest, you got shamed into it by a football player, a young football player with a conscience, who managed to prick the conscience of you and the government. Do you regret now, given how glad you are that it's now happening, do you regret voting against it?
Well, of course, I'm pleased that we're making sure that
That wasn't the question.
during
I just
this
asked if you.
lockdown.
I asked if you regretted. But hang on, it's a very important question because you wouldn't have done it without Marcus Rashford campaigning. My question for you is, given how glad you now are that it's happening, do you regret voting against it? It's a yes or no.
Well, as I say, I'm really glad that it's happening now.
But do you regret it? Do you regret voting against it?
Well, I'll put it this way. In the first lockdown, we took this action. And now, as you say, we're in a second.
Secretary, you only have to say yes or no, whether you regret it. You either regret it or you don't.
Well, I'm really glad that the situation's been resolved.
So you regret voting against it?
I'm really glad it's been resolved and we've sorted it out. And I'm going to use my own words to describe my own feelings on this one.
So you won't answer the question?
Well, it's that I'm answering the question, and I'm really glad that we've sorted.
Well, let's just hope going forward we don't rely. Let's just hope we don't have to rely, as we have to again this week, on Marcus Rashford to once again expose the iniquity of this system, because these kids are in lockdown, they're suffering, they're hungry, and they need support, and they need proper support from you as Health Secretary and the government. Thank you for joining us, Matt Hancock.
We're back in a moment.
And the good thing is, Piers, that's what we're delivering, and we're sorting out this problem. And ministers in the Department for Education who run this policy have spotted this, acted on it fast, seen the company.
Yeah, but Gavin Williamson, to nobody's surprise, Gavin Williamson didn't spot it before it was put on social media.